nerve fiber layer myelination and visual loss. Straatsma syndrome is a rare disease entity characterized by the triad of unilateral myelinated retinal nerve fiber, axial myopia, and amblyopia. Variations of the triad include a reverse Straatsma syndrome in which patients exhibit hyperopia instead of myopia. Traditionally, it has been considered a uniocular disorder, but cases of bilateral Straatsma and bilateral reverse Straatsma have also been reported in literature. So the case is a 29-year-old male presented with painless progressive diminution of vision in both eyes since 2 years. There is no association, aggravating and relieving factors, no diurnal variation. There is no history of any systemic illness, no relevant family and personal history, and general and systemic examination were within normal limits. The anterior segment examination was within normal limit, with the uncorrected visual acuity in right eye 3/60 and in left eye 6/18 partial, and improving with pinhole to 4/60 in right eye and 6/12 partial in left eye. So this is the cycloplegic AR findings, which in which there is a spherical power of plus 11.5 diopters in right eye and plus 5.75 diopters in left eye. So, on dilated fundus examination, we see bilateral type 1 retinal nerve fiber layer myelination. OCT macula is within normal limits, and OCT optic nerve head shows retinal nerve fiber layer thickening. Systemic evaluation was within normal limit. Treatment, full refractive correction with plus 6 diopter spherical in right eye, which improved the vision to 5/60 and N36, and in left eye it is plus 3.75 diopter spherical, which improved the vision to 6/6 N6. Coming to discussion, in 1856, Rudolf Virchow first described myelinated nerve fiber as thick, opaque, chalky white spots which spread around the disc in a shape of star. Rare lesions that were observed in only 0.98% of individuals and 0.0554% of eyes in large study of 3,968 autopsies conducted by Straatsma. It is generally isolated findings, but can be associated with various ocular and systemic abnormalities. Commonly, they are commonly asymptomatic, and their effect on visual function is highly variable depending on the location of the lesion and the extent of the lesion. According to the location, myelinated nerve fiber can be classified into type 1, type 2, and type 3. Type 2 is was usually associated with worse prognosis. Bradley Straatsma et al. First described Straatsma syndrome in 1979 as unilateral myelinated nerve fiber in association with myopia, amblyopia, and strabismus. Accompanying strabismus has been reported, but there was no strabismus in our case. Myelinated nerve fibers are more common in myopia than in hypermetropic eyes. In patients with bilateral hypermetropia, myelinated nerve fiber occur in the eye with lower refractive error, which is consistent with our case. The most critical and challenging part is the associated amblyopia and its treatment. An important prognostic factor, according to major series in the literature, seems to be the degree of anisometropia. Because of poor visual acuity outcomes, despite aggressive therapy, Ellis et al. Postulated that an organic etiology may also be present. In a recent series of 3 patients with Straatsma syndrome, poor visual acuity was associated with loss of disturbance of the ellipsoid zone, and was postulated that organic pathology is present with poor prognosis, which might be related to that. However, in our case, the ellipsoid zone was intact. Reverse Straatsma syndrome seems to be generally associated with poor visual outcomes, especially in treatment with in patients with post-treatment visual acuity predictors such as deep anisometropia, strabismus, type 2 myelination, extensive myelination, and macular involvement. However, there are several reports of unexpectedly good response in the literature, even in patients with these predictive factors. All patients should be approached optimistically and provided aggressive amblyopia treatment with appropriate refractive correction. Thank you.
Well documented.
Thank you, sir.
What is the educational status of the patient?
Sir, he was not educated, sir. We had to use it with
That answers
C-chart.
everything. He has come to the hospital in 29th year saying that he has some problem.
Yes, sir.
Though one eye is absolutely a very high power, plus 11,
Yes, sir.
other eye is also having an error. And most probably that explains everything, because he is not bothered about the vision, whatever it is. He accepted whatever vision he is having.
Yes,
Thank
sir.
you.
Thank you, sir.
Again, congratulations, well documented case.
Thank you,
These
sir.
are rare cases.
Yes, sir.
So, what according to you is the difference between the Straatsma and reverse Straatsma syndrome?
Sir, it is, sir, in Straatsma, sir, there is myopia, but in reverse Straatsma, there is hypermetropia, sir.
Very good. So, and what is the cause of poor vision usually? Is it related to myelination or is it related to amblyopia?
So it is because there is more degree of anisometropia which leads to amblyopia, sir.
So that is a very important message everybody should carry. That at least part of the vision can be recovered in majority of these patients because the amblyopia is due to anisometropia. Thank you.